Afternoon, everyone. Welcome to Isaiah Aguon. And joining me is the director of Guam Behavioral Health and Wellness Center, Miss Therese Arriola. How are you, Miss Therese?
Very good. How are you? Thank you for having me.
Thank you for joining us. So let's go ahead and jump into the interview. I wanted to see how has the crisis hotline numbers looked for the month of October?
Well, I can honestly say that the crisis hotline, my staff, my professional staff have been very busy. September, we had around 1,028 calls for the month of September. For the month of October, we just rounded off and looked at the numbers. We're slightly lower at 917. Our hotline professionals are still very busy. Major concerns, of course, haven't changed a bit. Depression, anxiety, loneliness, a lot of COVID-related concerns. And so we're still pretty high in the 900s, 917 on October. I just want to take this time to thank the people of Guam for getting vaccinated, for continuing to be practicing preventive measures, because as you can tell with the CAR score, it's going, there's a downward trend. So we anticipate the use and calls to be lower and lower as our community gets safer and safer.
Awesome. So Miss Therese, I just wanted to see what has the detox inpatient facility looking like?
Yes, so the detox unit here at Guam Behavioral Health that we opened in August of this year is doing well, steady, but definitely sure and a needed service for those who are in withdrawal for substance use. Of course, meth is always, it's the prevailing substance choice on Guam, concern drug on Guam, meth. So far, since late August, when the unit opened, we have serviced 7 individuals who needed medically detox assistance before they're referred to outpatient services. So thus far, it's been 7. It doesn't seem like a lot, and that's because there's other services that many people are referred to. But these 7 needed medical assistance in detoxing safely before they get referred to outpatient services. So we've had a total of 7 consumers who have taken advantage and is well on the way to recovery, and with their next steps with outpatient services.
All right, and just to clarify, there is no waiting list, correct?
There is no waiting list. Because we just started this in late August, we continue to refine the process. There is no waiting list. As the professional staff refine the process, I'm looking at opening an additional 4 beds. If you recall, we wanted to start slowly. So there was a total of 4 beds open. And so now as months have passed and the team is getting the process and the program more refined, I think we're good to go, and I can say that we'll be opening it up to 8 beds, and hopefully more and more people will be able to. Well, there's definitely not going to be a waiting list. There's not a waiting list today, and so, but more beds means more opportunities for more people, and we're refining the screening process, which probably will mean more people will be eligible.
Mm-hmm. And
So,
just to
and this is the growing pains of a new program. You know, staff has to get used to the program, the processes. And so we anticipate that as we refine the process for admission, that there will be more people who will be eligible and will be able to avail themselves to the 3.7 detox unit. And that's why we're coinciding with increasing the number of beds available. But as of today, everybody who qualified for the program thus far was able to come into the program and be serviced. And so that's what matters, is that the people are being serviced.
Awesome. Is there any clients currently in the program enrolled right now?
No, actually, today, I mean, there's normally one or two. I looked at the census that the staff that gives me every day. And today, of all days that you interview, I have 0 in the, but we might have an admission later. But right now, there are 0 clients in the detox unit.
All right. So, Governor Lulian Guerrero and you, when you guys first cut the ribbon in June, you guys mentioned this was a drug epidemic. And as you mentioned, there was no waiting list. Is there possibly reasons why not people are signing up to this program? Maybe people aren't aware, other than, they're being directed to other programs?
Well, like with every program, there's an eligibility requirement. They must be eligible. And so we have various programs here at the department. And so I can tell you that our front door, our intake process is still very, very busy. But again, there are certain requirements like active withdrawal. Maybe a lot of people are coming. My assumption is that people are not in active withdrawal at the time when they come and seek help, and therefore they're not eligible for the program, but they're eligible for referral to other programs such as outpatient services, or being referred to a residential treatment program, and so, or medically assisted treatment program, giving medication to help them. So it's the variety of programs, and that's what you want. You want to have an array of services so that the consumer is referred to the lowest level service that they need. And so I can only say that there's 7 who have been helped, and that's 7 more that wouldn't have been able to help if we didn't open the detox unit.
Awesome. Thank you so much, Director. November is Men's Mental Health Awareness Month. I wanted to see what Aguon Behavioral Health and Wellness Center is doing.
Yep. And so we do recognize November as Men's Mental Health Month. However, the department celebrates Mental Health Month in May. But in recognition of Men's Mental Health Month in November, you'll be seeing social media posts and in our social platforms promoting awareness that it is men's mental health is just as important, promoting the crisis hotline if men need to call. And so we're not doing a major program like we would do in May for May Mental Health Month, specifically for men in November, but we're just reminding the public through our social platforms that men's mental health matters and that you're not alone. And so be looking out for a lot of flyers and Instagrams and different promotions that's going to be in our social media pages and platforms, whether it's Instagram, Facebook, and Twitter.
Okay, Director Arriola, I wanted to see there was media reports going around that you guys didn't have a psychiatrist on board. I wanted to clarify and see if you can clear that up or confirm.
Well, that is not the case. We do have a psychiatrist on staff. He has been on leave, like everybody does, they have to go on leave. And so we do have a psychiatrist on the payroll. and he is currently on leave, but he's expected to come back at the end of the month, which is really a week, next week or so. And so it's unfortunate, but this is a shortage crisis in the profession of psychiatrists that is affecting the entire world. And I'm happy to say, though, that I just offered a psychiatrist that we interviewed an offer, and he has accepted. So that will be as soon as his contract is routed and cleared and everybody signs, he should be starting, I would say, hopefully in the next 2 months or a month, if we're lucky with the contract process of everybody reviewing. We're very happy. For the first time, we have our first psychiatric nurse practitioner. She's an off-island hire as well, and she started last week. We have several medical doctors on staff, and we have 2 psychiatrists that will be coming to Guam next year, who we've already interviewed, and they're very interested in moving to Guam, but they're just waiting for their final contracts, the current contracts they're in. So that's another 2 psychiatrists that will be coming on board next year. In addition to that, as sadly as we had lost two psychiatrists to retirement, I just got word earlier this week that they are inclined to come back in the first of the year, which again is just a couple of months in January, as a part-time basis. So I think between the medical doctors and the psychiatrists that we have, that we're going to have, and the psychiatric nurse practitioner, and we have another psychiatric nurse practitioner that started a couple of months ago, I think the people of Guam are going to be very pleased that you have an array of professional services to help you at the department.
That's awesome, Director. And I'm just adding my numbers. Is that a total of 8 members that we can expect by January?
We have a current psychiatrist, a new offer psychiatrist, that's 2, an additional 2 that retired and is coming back probably in January, 2 more that will be leaving their contract next year and coming on board. So that's a total of 6 psychiatrists.
Awesome. Thank you so much for that clarification. I'm not good at math. That's why I became a reporter.
6 psychiatrists, 2 psychiatric nurse practitioners, and 3 medical doctors.
Awesome. Thank you so much, Director Arriola, for that. And I also wanted to get an update, is there any other staff shortages within the department that you guys are looking to hire or,
Yes.
I guess, address?
Thank you very much, Isaiah, and I appreciate KUAM and the media's help in getting the word out. As you know, and I've been saying this for almost a year and a half, the Guam Behavioral Health with COVID has tripled our caseload. It's a good thing because that means people are coming in and getting the help they need, but we are in shortage of therapists, counselors, master's level counselors who can provide therapy to our consumers. We have a wonderful probably 10 to 12 counselors, but we are in need of more. And so, but we're looking for master's level counselors, therapists. And so that's what we're really in need of. And we are working. I have a call in to the University of Guam to try to talk to the program folks there to see, because I understand that there is a graduating class in December. I want to be able to pick them up right away and get them to work, get them to practicing what they chose and love to do, is helping people. And so we're going to be working with the University of Guam. We have set up some meetings next week because we want to make it seamless. We want to capture those graduates and get them right to making to the workforce.
Hmm. Sounds like the
So really,
department
it's
is
counselors.
super busy.
Yes. And you know, recruitment is constantly ongoing here at the department, constantly. We're never at a given place where, you know, everything, we have all the staff at one given time. I mean, I get retirements every day, people leaving because they're moving off island. So there's constantly moving, people being promoted, which opens up another position. And I mean, there is just a constant recruitment going on here at the department. And but the one thing that I've been really focused on is the professional service staff, the psychiatrists, psychologists, counselors, nurse practitioners, medical doctors. That's what I've really been focusing on lately. Um, I forgot to mention, and you know, it's terrible, but we, you know, psychologists, clinical psychologists, we're looking into clinical psychologists being able to prescribe like a psychiatrist does. I don't want to trump it yet, but we have a clinical psychologist on Guam who has agreed to work for Guam Behavioral Health part-time, and he's working with the license board to be approved. And so we look forward to that. And so, you know, again, the people of Guam can be confident and know that you have a professional array of professional services, professional staff here to serve the people of Guam who are in need of help.
All right. And, you know, as you guys are always trying to combat or definitely try to address the drug epidemic here on Guam, I recall that the Taufofo cottage homes were turned over to the department. I just wanted to
Yes.
get an overall general update on the renovations.
Thank you for asking. We're so excited. The Leon Guerrero Tenor administration is ecstatic. We are in the process with DPW and GURA finalizing the designation authority so we can work with GURA. DPW will be assigning that authority. So, you know, officially signing it perhaps before the end of the month, if not early December. And then the RFP will be put out, and renovation, I would say, will begin, you know, early next year. We anticipate no more than 6 months, and then we'll have 30 more residential beds to help our people in recovery.
Awesome. Is that also including is there some sort of drug rehab center adjacent
okay.
to
You're
the current
talking
facility?
about the
Is
other.
no, well, is there another program? Yeah.
Yes, there is. I just want to thank Governor Liu and Lieutenant Governor Josh because they identified Department of Interior money to renovate Cottage Home in Talafofo for 30 more residential treatment beds. But they also identified DOI money to build our new beginnings, our drug and alcohol division. As you know, Guam Behavioral Health has a drug and alcohol division. It's known pretty much by the people of Guam being called New Beginnings. Currently, we are renting and we are so busy, we're running out of space and it's just too small. So the Leon Guerrero Tenor administration, to keep its word and its commitment that drug and alcohol services is a priority, has identified Department of Interior money to build a New Beginnings Drug and Alcohol Treatment Center, where our drug and alcohol division will move into, and there'll be more than enough rooms for group, more than enough rooms for treatment and counseling, and we are not busting out of the seams in rentals. And so as a commitment, it's going to have a permanent home and not a rental. And we also simultaneously, the RFPs will be going out at the same time as cottage home. So as cottage home is being renovated, we anticipate the construction of the new building to begin as well next year.
Awesome. That sounds so much work that the
A
department
lot
is
of
doing and
things
so much
going
progress.
on. I'm blessed. I am very blessed with a governor and a lieutenant governor that really, it's not lip service that they want to help our drug pandemic really, but really putting real resources and real funding to building up the infrastructure to help our people who are struggling with drugs and alcohol.
Awesome. Anything else you'd like to add on? The mic is yours.
You know, the holidays are coming up. I want to wish everybody a very happy Thanksgiving, a peaceful Christmas. Things are looking better. The CAR scores are going as a downward trend, but we need to keep it up and keep up our preventive measures. But I bring up the holidays because as wonderful as the holidays are, there's also a time when depression is heightened. You know, there's this thing called the holiday blues. Guam Behavioral Health Crisis Hotline will continue to be open and continue to be available 24/7 through the holidays, throughout the year, never closing 365 days a year. We'll be around in the holidays for people to talk to somebody if their depression or the holidays gets to them too much. So I just want to put it out there again, 647-8833 is our Guam Behavioral Health Crisis Hotline. We're here through the holidays and all year for the people of Guam. Call us if you need to talk. You're not alone. We can get through the holidays and the blues and whatever anxieties you're going through together. That's what we're here for. That's our job. And we want to. This is what we are here for. This is why we're here to serve, is to be there for the people who need the help. So we're here. Don't forget our crisis hotline, even through the holiday season.
Awesome. Thank you so much, Ms. Arriola, for hopping on this interview and giving us an overall update on the Guam Behavioral Health and Wellness Center.
Thank you so much, Isaiah, and I wish everyone a blessed holiday season. Merry Christmas. And don't forget, you're not alone. So if you're struggling, call our Guam Behavioral Health Crisis Hotline at 647-8833.